I'm Dr. Fiona Durbin, Clinical Lead for Cosmetic Courses, and I'm going to show you today approaches for the mid-face using filler. So the mid-face is a really popular area to target because as we age we lose volume and shape in the mid-face, which leads to increased laxity of the lower face. But the common assumption sometimes is that cheek means the anterior cheek, the apple of our cheek, and actually to get lift of the lower face we want to concentrate on the lateral area. So I'm going to show you how we would look at marking up. So the first area we concentrate on is the cheekbone, the zygoma. So I'm drawing the top and the bottom of the cheekbone. And if we wanted to give someone more contour, this is the area we'd concentrate on. Plus some filler positioned onto periosteum here will help lift the nasolabial fold. So the arch of the cheekbone is also going to give the face a little bit more shape, re-establish the sort of triangular appearance where the mid-face wants to be wider than the jawline. So this is where we would do deep injections using Juvederm Voluma. The preauricular area, which is the area in front of the tragus of the ear, is another popular area to help give lift of the marionette and jowl area. And this is an area, probably my favourite, which can help soften the shape of the lateral cheek if someone looks a little bit too step-like, having augmented the zygoma, but also to help lift this lower face area. So here we would use a cannula to fan our voluma subcutaneously to give that nice lift. So that's my, I think, favourite area here. But we mustn't forget the anterior cheek. We do lose volume here. We want to be careful because our infraorbital foramen is positioned here. My head's a little bit unstable. So we'd want to use again a cannula into the deep malar fat pad to give someone a little bit more convexity and shape, often blending it in with the side over the zygoma, and we can often do that from one position and further augment over the zygoma a more superficial layer, which is then called the top model cheek. And lastly, the lower anterior cheek, so particularly older ladies or people who are athletes start looking gaunt when they lose a lot of volume in this area. So again, we'd use a cannula because the facial artery has quite a tortuous route across the mid-face here. And sometimes, because this is for shape, not lift, I might drop my product down in amount of hyaluronic acid to lift. I'm not always using Voluma, particularly if they've got thinner skin. So this is a really popular area to treat. It gives nice natural results and a better shape for the patient if we look at utilising all areas and not just concentrating on one.